Hello, friends. Welcome back to this episode of Test Those Breasts. I am your host, Jamie Vaughn. Today, I am so excited and honored to have my friend and nurse, Amanda Thomas, on my show. Amanda is a registered nurse certified in oncology and has worked in nursing for the last 12 years in Reno. She is committed to serving others with resiliency, mindfulness, and self care trainings. Along with her passion for nursing and resiliency, she has been a dedicated mindfulness practitioner for the last 15 years. Managing the stresses of life, work, and anxiety are the path that led Amanda into mindfulness practice. Daily, she continues to refine her practice through sitting, walking meditation, qigong, yoga, online workshops, and retreats. Deepening these practices inspired her to share with others, and she is currently enrolled in the 2025 cohort of Mindfulness Meditation Certified Teacher Program led by Jack Kornfield and Tara Brach. Amanda's mindfulness journey continues to improve her work and personal life, fostering strong interpersonal relationships. During her self care journey, she became dedicated to a nonprofit organization called Vital Hearts. The training she received has been instrumental in supporting her career as an oncology nurse. It has inspired her to lead trainings for others in hopes to positively impact them with tools needed to lead a balanced life personally and professionally. In her personal time, she enjoys spending time outdoors, hiking, camping, paddleboarding with friends and family. An active lifestyle has helped her to embrace the importance of deliberate rest and rejuvenation. Rest practice has helped her to show up more wholly each day. It has been a joy to share the positive impacts this can have for others' lives as she deepens her relationship with the dimensions of rest. Well, welcome,
Mm.
Amanda. It's really good to see you, and I see you. It's audio, but it's really nice to have you here with us this afternoon. And I am just so excited that we finally got this opportunity to have a discussion together. You and I have a pretty interesting relationship in that I met you at Renown Infusion. That's our hospital, our local hospital here. And the circumstances were strange as far as I'm concerned. You kind of took an interest in me and the bizarre scheduling that I had because I don't know if the audience really knows, but when I found out I had my cancer, they also found this thymoma tumor in my thoracic cavity that apparently I've been walking around with for years. And it was quite large. And long story short, that thymoma tumor had caused this rare anemia called pure red blood cell aplasia anemia, and which
Mhm.
made it so that I had to get constant blood tests, like 3 times a week or whatever it was, and also blood transfusions. So scheduling for me was very wacky and very difficult for Renown Infusion to be able to do that. And so I know you took an interest in that, and somehow along the way, we met each other and we have been connected in such a special way that we've become friends. And I find you and your life and your work to be so fascinating that I just wanted to have my audience understand who Amanda Thomas is and what you do for our community and why it matters. So, welcome.
Thank you. Thank you for that warm welcome. It's heartfelt. Yeah.
So, first of all, before we started this interview,
Mhm.
you had us do a 30-second mindful activity sort of strategy, and we're going to talk about mindfulness in a little bit. I know that it's super important when we have illnesses like breast cancer or any cancer. And when I say breast cancer, I also mean other cancers. That is so important to be able to understand that it's not just about the physical illness. It's not just about that cancer that's inside of us that's trying to kill us. It is about trying to figure out a way to go through the treatments and recovery and healing process. And a lot of it has to do with our emotional and mental ability to be able to move through it and using strategies such as mindfulness and yoga and whatever it takes, right? So, your professional title is
Hmm.
chemotherapy specialist infusion services. Can you share with our audience what that actually entails?
Yeah, yes. So I started my oncology nursing career about 9 years ago, and I've been a nurse for almost 12 years. But during my time in the infusion center, I realized there was a lot of opportunity to bridge gaps between care providers and the people actually delivering the care that the physicians are the plan of care for treatment for the patients. And a part of that is because we have a large community and we have a community providers along with institutional providers. And then they funnel in to the infusion center where patients are receiving their care. And so that leaves a lot of opportunities for the possibility of things to maybe not always align for when the patient, when they arrive for their treatment, to be where they need to be. And so during my time identifying a lot of those obstacles and barriers and working through them, I reached out to my leadership at that time and said, I really feel like we could benefit from having someone that would actually pre identify all of these possibilities that could be worked through prior to the patient arriving. And so we developed the chemotherapy specialist RN position during that time. And this fall will be 4 years. So I work in the background, identifying, I review all of the oncology treatments and patients coming in to the infusion center. And then I collaborate with the physicians to make sure that their orders are correct and that they're signed. But not only that, like in your circumstance, I using my skill set and knowledge to identify like, wait, are we missing something? Could we improve something as well? And can we link things together so that everyone is really ultimately working smarter, but also allowing the patients to receive the best care that they deserve too, because I go into every day knowing that everyone involved in someone's patient care, their heart is there because they wouldn't have chose the profession that they're in. But then we have the worlds to work around and the processes to smooth out. And so that brings me a lot of joy to be able to not only help our patients receive the wonderful care that they deserve, but alleviate some stress for our providers, for our other nurses, for the pharmacists, and then even connect people to further resources like the social support services through nurse navigation. I kind of am looking at it through all the lenses, along with collaborating with outside institutions if necessary.
Okay. Yeah. Well, I have to say that when I first started going to Renown Infusion, I got my cancer treatments and things at another facility. But when I started coming to Renown, and before I ever met you, first of all, the nurses over there are amazing. They are just
Mm.
wonderful human beings. But I really did feel like I was sort of disconnected. I felt like I was an outsider coming in, and I had such a unique situation that I was confused because, I mean, lucky me with this rare anemia and having to go through all of this stuff and be there at 3 and 4 times per week, and I was so disconnected, and it was when you entered the scene and, like, really showed up for me. I have to say that was, I don't know that you know this, but that was so meaningful to me because I felt more connected. I felt like I was somebody who was important, and I felt that you care and you did care. And in turn, everyone else cared. Like everybody knew my story for the complex situation that it was. And because I felt that way when you came onto the scene and showed up for me, I believe that it was really good for my mental health because I was in a really deep, dark place because it was one thing after another. And I didn't understand it. When I got to having more conversations with you, I understood the complexity from your end, from being able to schedule me and when were appropriate times for me to come back in order for me, because I had also, what do you call, antibodies in my blood. So that made it even
Mhm.
more complex because we had to have like a 2-day window of time for me to have you guys take my blood and then get the transfusion like 2 days later. So it was just a mess. So
Mhm.
thank you for reaching out to your leadership and having them create that position. I really feel like all hospitals need to have that because it just makes it a lot more, I guess, bearable for patients like me. Yeah,
Mm.
that's really interesting. So, as you are caring for your patients, what is the experience for you? Like I was just talking about showing up. What is your experience showing up for them on a daily basis? And how does that impact your life personally and professionally?
Mm. Yeah, I feel very grateful to be able to do the work that I do. It is so special to be able to use my knowledge to help ease anxieties for people and just let them know that people do care. I appreciate that you shared that you did feel important because you should feel important. And I also think it's really important for patients to know that people are collaborating for their safety and for the plan of care that they're receiving. And I feel like to answer your question, what it's like to care for my patients that I am blessed to be able to work with, it is a true privilege. It takes a certain level of making sure that I'm taking really good care of myself so that when I show up to be that layer and lens of safety and connectedness and presence as well for my patients, that's really important to me. But when you are connected to something that deeply, personally, I have to truly make sure that I'm taking really good care of myself physically, mentally, and spiritually. And throughout my journey as a nurse, that has just deepened. I have a better understanding of my own needs so that I can show up for my patients and for my coworkers as well.
I love that. You actually were making me cry right there. So thank you for caring. I know not all nurses and people in healthcare care as deeply as you do. And it definitely comes across as very genuine. And I know that it's genuine. And I know that all of the nurses in Renown Infusion have shown up for me as well. And I really believe that is part of being a team. You all
Mhm.
seem to have this philosophy, this deep rooted philosophy that showing up for patients like that is incredibly important. And it also affects you personally to be able to become close to those patients. And I'm sure that that's very difficult sometimes when you lose people in your line of work. It's very difficult when someone dies. And, but I'm very grateful that you are there. So thank you for sharing that. Mindfulness. I brought that up at the beginning because you had us do some mindfulness and I started yoga. I intentionally started yoga because I needed it for a few different reasons. One, physically, I've had 2 very major surgeries, one being the bilateral mastectomy and reconstruction, and I had the autologous deep flap surgery, so I have incisions, and then I had the thoracic surgery to get the thymoma tumor out, and that was, like, within 5 weeks of each other. So my body has been through the ringer this year, and I decided to take it to the next level and do some yoga, but that includes that mindfulness, and I love that. It keeps me grounded, and you had us do a little 30-second mindfulness.
Mhm.
Can you share one of your I know it's such a passion of yours anyway, so can you share this idea of mindfulness and how you interpret that mindfulness and why it's important and how you actually incorporate it into your practice?
Yeah. My mindfulness journey started maybe about 15 years ago or so. And it found me in a time where just learning to understand the complexity of my own emotions and deeper understandings to cope with anxieties and different things. And I've just continued to deepen that practice. And it's been so serving to me. And I feel like one of the main reasons why I can show up in the ways that I do for my patients and just also in my own life. Mindfulness to me, I feel like is just coming back to our present moment with awareness to what's actually going on for ourselves. So there's the complexity of all these things that we're aware of internally and externally, and then having that space enough to be aware of where we are actually in this moment and then what is affecting us into that moment. And so just coming back to that awareness so that we can better understand ourselves and why we're maybe behaving the way that we are, why we feel the way that we do, and then how we can support ourselves. I think is the other key component that speaks to me in this moment of sharing about mindfulness. And I thank you for letting me offer that. I just wanted to have us, I know it was something that brought us together. Well, I remember sharing that body gratitude meditation with you and just allowing those just even snippets, that 30 seconds of grounding ourselves before we came into this space together. It just felt so special. And I really appreciate you.
Well, and you as a nurse giving me resources to be able to cope with my own feelings and emotions at the time that you did was very helpful. And I know this isn't one of our questions, but I want to get into this to see if you can share anything. And if not, we can collaborate and figure something out. Is there I believe that incorporating mindfulness into our own situation is very healing for any kind of patient, cancer patient, whatever. Is there a body of research out there that says that has some sort of proof in any way that mindfulness helps with that healing process?
Mhm. I'm sure that there is off the cuff. I wouldn't necessarily know the resource to link that to. However, I've shared with you that I'm on a journey to become a certified mindfulness teacher as well. And so I have a lot of resources and am connected to being able to find out like the right resources to answer that question. But I feel like I can undoubtedly answer it as yes. There's been a lot of studies, and I look forward to being able to find out specific ones so people can find out that information for themselves, see how it resonates, and then deepen in the direction that speaks to them.
Okay. Yeah, the only reason I ask is I've talked to quite a few people during my journey who may have been like 1 and 2 and 3-time cancer survivors in that they are cancer free now and they truly believe that when they finally started to incorporate mindfulness type strategies and even any kind of practice, anything that works for them, Reiki,
Mhm.
qigong, yoga, Pilates, whatever it takes. And they truly do believe that by incorporating those kinds of strategies, that is why they are cancer free today. So when we do have some resources or whatever you do have, because I'm going to ask you for resources, one of the reasons I started this podcast is to shorten the curve for cancer patients because when I was diagnosed, I was incredibly overwhelmed. And I'm the type of person to really research and find and reach out to whoever I need to reach out to help. And I'm also really passionate about doing that for others. So I wanted to make sure that there was some sort of resource out there, like my podcast, where people can listen to episodes that will serve them at any given time. So I feel like this is going
Mhm.
to be really big for people because there's that physical, oh, we need to get rid, we have the chemo, we have the radiation, we have this and the meds.
Mhm.
But how do we take care of our heads and our hearts and just our nervous system to be able to move
Yeah.
forward through that healing process?
May I share one
Ye-
thing that came up when you were sharing that I've had a moment with that I go back into giving my direct patient care, or even when I arose with you, in the sense that I think part of why mindfulness can be so serving for someone on their cancer journey is that it really is helping to come back to the moment. And so, why there are so many fears and anxieties around a cancer diagnosis, most of the time when we come back to our present moment, we are safe and we are whole. We're in this space of just where our mind might be taking us somewhere else. And just having that differentiating moment can be really impactful for people. And then the last thing that I wanted to share around that that I think is very important, and that hasn't been an inspiration since the moment I met you, is really like with mindfulness, honoring all that is and nothing, no emotion should be unwelcome. It should all be welcomed and honored and nurtured in some way because it's there for a reason and it deserves to be honored. And I really love that mindfulness can support people in that way.
And I'm really glad that you brought that up. I have a really good friend of mine who is battling cancer right now. And she and I talk about that a lot. We talk about things that people say to you that sort of diminishes your emotions. So, like, I've had a lot of fear this year. Oh my gosh. When my mom died in 2019, I was incredibly fearful because it was like I lost a limb. And I grieved so hardcore, and I was so fearful to go how I was gonna live the rest of my life without my mom. And I allowed myself to go through all of those feelings, anger, fear, tons of anxiety, and I allowed myself to do that. There are certain beliefs that we need to keep our mind positive, and yes, we don't wanna remain in a dark place too long. We wanna be able to pop out of that and move forward, but we also do wanna honor our being afraid and talking about it. So I'm a very open person, and there are some people who are very private, and which is totally okay. Everybody gets to deal with their situation the way they need to deal with it. But I do believe that we need to honor those feelings, and people need to recognize that it's okay to be fearful and allow people to be fearful. And I know that part of it is because they don't like to sit in the uncomfortable with people because it
Mhm.
really can be uncomfortable. I know that I had friends come over to my house, and I know that they were really worried about me at times because I was so angry and I was so fearful and so anxious and all of the feels. But they allowed that for me, and they were able to sit with me and sit in the uncomfortable and then kind of carry me through. So, I'm really happy that you brought that up because it's such a big thing right now.
May I ask you one question
Yeah.
because of that? When you were able to allow those things, were you able to feel them flowing through you rather than be stuck in you?
Yes. And because I sort of had to learn how to do that. And
Mhm.
I remember last year, and I've told this story briefly before, and I actually interviewed Eddie Enever, who I met on Facebook, actually. It
Mm.
was last July before I started my chemo, and I was in that deep, dark place. I was like seriously suspended there. And it scared me because I was like, oh my God, if I stay here, this is not gonna go down well. I'm gonna have to figure something
Mhm.
out. And so I've always had the ability to figure out how am I gonna get through my anxiety. If I know that I need therapy, I'll go to therapy. If I know, that I need to go out for a run or whatever it is, I'll do that. This was like paralyzing. And I remember waking up in the middle of the night and reaching out, trying to find anything, anyone, any support groups on Facebook. And I found Eddie. And he is the three-time cancer survivor that he's a therapist in Australia, and he's amazing. So if anybody hasn't had a chance to listen to that episode, you've got to listen. It's wonderful. That man really truly did help me out of being suspended that way. We got on Zoom, we talked a few times, he talked me through mindfulness and also through incorporating anything that works. He goes, "I don't care if it's Reiki, I don't care if it's yoga, I don't
Mhm.
whatever makes you feel better to be able to get through this." He says, "Because I know that I got cancer 3 times because I did not pay attention to my mind and to my nervous system. I was really just paying attention to the physical this cancer inside me that I had to get rid of and all the meds that were going through me." So yeah, I was able to finally let it flow, and then I was able to go on to the next day, and I took it day by day. That's what we did. My husband and I
Mhm.
did together. Yeah.
Yeah. No, thank you for answering that. And the reason that I asked was because I know for some of the training I'm going through, but some of like my own personal practice is the more resistance I have to not feeling a certain way, the more I feel that way. It's like surrounding me, it's engulfing me, and the actual allowing process, which can feel so scary to
Yes.
do, to like dip a toe. That's why also just the ease of it. We don't need to dive in for head first, but can we dip our toe in to allow ourselves to feel this way? And from that practice, I've definitely been able to feel things flow through me in a much more healing way rather than feeling stuck in some of those difficult emotions.
Right. Well, and I truly believe that, about marriages too, any kind of relationship where you are in this relationship with this person and you're having issues and you try to resist certain facets of your relationship and your problems that you're having. Like there's elephants in the room everywhere and you can't talk about it. And I feel like those people who take the steps and get that therapy that they need to be able to dip their toe into those emotions, like you were talking about, to deal with the elephants in the room. And the more you talk, my husband and I talk about this now. It's like therapy has been the best thing for us. My husband, of course, is this, "Oh, I don't care. I don't want to talk to therapists all day long or whatever." Many people are like that. I wanna say, but especially men. You don't find, a man usually, "Yeah, yeah, let's go to therapy." Not in my experience anyway, but my husband is very willing to do that begrudgingly. But then when we go and we really do open up and talk about this, we just started going last March because even though I was cancer free, I was not done healing. And he thought, "Oh, we can just move and get back to normal." And that caused some friction, and so he will talk to you. He will tell you now it is the best thing that we could have done because we do get to talk about the uncomfortable, and it pulls us through. We don't resist it. We just go and we just say it, and we feel
Mhm.
it, and then we talk about it later. So, I feel like that's the same type of thing as suppressing your emotions when you're going through this scary cancer stuff, right? So, yeah, I think that's super good advice there. So you happen to be connected to a nonprofit in Colorado. Can you share with us what is involved with that and how that impacts your life and our community?
Yes, I feel so grateful. So the organization is called Vital Hearts, and I was lucky to be able to actually there was a Live Strong grant a couple of years ago, I'd say in 21, May of 21. There was a Live Strong grant that had supported oncology professionals to attend the training. So they specialize in a 3-day training for healthcare providers to help build resiliency specific to secondary traumatic stress that we can take on while providing care to our patients. And so they do this 3-day training that I was lucky enough to go through with on that grant. And during that time and throughout my career, I definitely have struggled with suffering from burnout and not always knowing the right way to maneuver through that. And what I really loved about the training was it normalized that it's not if, it's when you become burnt out when you do the works that we do. It's hard work, especially if you show up to have deep, thoughtful, connected interactions with people, like on a true human level. And that does have a toll that it can take. So, how do we use actionable tools to build our resources for resiliency to be able to do that great work? And it was incredibly life changing. I actually walked away from that training thinking like this saved my career. I could truly do this work because I know how to manage it better. It makes me emotional just because it touched me so deeply. So I took all the tools for a year and practiced them and saw how significant it was to my personal life, most importantly, because I think it's easy to go into work and you do your job. So you do your work, but those little background things personally, like not feeling so isolated or having these like ways of not understanding how my work was affecting me personally. And I reached out to them in the beginning of the year of 22. And I said, this was so impactful to me that I would love to become a trainer. And so they were happy to have like my background and my enthusiasm. And I went through the training to become a trainer. And I've been able to lead a few courses, actually 3 of them. I've gone to Colorado to do some, and then be able to work. You asked how it is impacting our community. So for the last year, I've been working really diligently to be able to have people understand how impactful this training is for others. I did a kind of like a pre-course. I developed like just a 1-hour presentation out of my own time with the support of Renown to be able to present to about maybe 350 people last year during their staff meetings. And I got such a great feedback from leaders and from other coworkers and peers within the organization that I was able to present to the foundation of Renown if they would host and take care of the costs for a course. So this September, I'm so excited because it was like truly like a dream to be able to bring the course here. And like, thank you for holding space for my emotions. I just think it impacted me so much that if I can help others continue to do the great work that they get to do, that is part of my life purpose. I know 100%. So September 6th, 7th, and 8th, we're going to have our first local Renowned Foundation hosted event of 3-day training. And it actually, when I put out the information to see who would register for the program, it filled up in less than 2 weeks. And sorry, my phone just fell. Yeah, so it filled up in less than 2 weeks. And it is a small, intimate group. There's only 24 people that can be a part of this training because it is so customized and individual. And really, I love it because it's called, one of like the little captions underneath it is "The Healers Need Healing." So it offers such a beautiful space for healing. And I really felt that. And so I know the need is very strong, and I look forward to being able to celebrate this success because it took a long time to get it. But I do have goals on the horizons to continue this for our community of healthcare providers.
I think that is absolutely amazing. And can I just tell you, I love you so much.
Oh, thank
You,
you.
you have made me cry.
Oh,
I think that sometimes we, nurses and doctors and surgeon anybody in healthcare, and it's much like teaching too. I'm a former teacher. And so I think that sometimes when people look at you, they think you are the person who's taking care of me, this sick person. And we don't really pay attention necessarily to the mental health of our healthcare providers. And I just really believe that you have this deep passion and you have gone above and beyond to try to take care of yourself. Number one, that's so important because it's going to be very difficult for you to show up for your family, for your patients, if you're not taking care of yourself. So I just really am very grateful that you have gone down this path and to be able to help the other healers. Awesome.
mm.
So awesome. I love
Yes,
it.
thank you.
Oh my gosh, thanks for making me cry. Like
Uh,
such a great story. And you can just
mm.
tell that your heart is really into it. And to my audience, I know a lot of people are listening to this outside of our Northern Nevada area. And I'm hoping that in those communities that they also have someone like you who is out there not only taking care of and showing up for their patients like that with their whole heart, but also taking care of their mental health and going above and beyond and doing the work that needs to be done out there. So hopefully people can get connected in their own communities to be able to make that happen. I'm hoping.
Yeah, yeah. And if people aren't aware, I know that we'll be sharing resources that people
Yes.
can tap into. And part of that will be to connect with me and see how we can continue to expand those resources for
Good.
others.
Yeah, you have a lot to offer, Amanda. I'm just blown away. So, what advice do you have for, and this can kind of segue into what we were just talking about. What advice do you have for healthcare providers caring for cancer patients as they move through their career? This goes right in with what we were
Yes,
just talking about.
it does. Beautifully linked. I feel like my biggest advice is that if you landed where you landed, it was because your heart had a good intention of getting you there, but knowing that the work to get to that point is really just the beginning, and that there's a lot of nurturing to ourselves that will ultimately allow us to be able to be the best care providers and show up personally in our lives. But I think one of the key components is that no one can do that work except for ourselves. And so when we can honor that it is our job to take care of ourselves, we are worthy to receive the care from ourselves. And then if we do notice that what are those barriers not allowing us to care for ourselves, being honest with those, stripping those away, that we can do incredible things for people. And so just knowing that this is something that does have a cost to ourselves and knowing that, then how do we learn how to lessen that cost so we can make such a beautiful, powerful impact on others?
Great. And I hope that if any nurses out there who are listening, any healthcare providers who are listening, I'm hoping that they will go into the resources that we're going to leave in the show notes and be able to reach out to you, because I just feel like that would be such a wonderful step for so many out there. So thank you for sharing that. So with that, why don't you
Mhm.
share some of the resources that you have for us that we're going to display in the show notes?
Okay. Well, I have a book that was very impactful to me on my journey for self care called Pace of Grace by Linda Popo. I've shared it with you, and
Yes,
you might have gotten your own copy if my memory serves me
I did.
correctly.
Yes, I did.
Yes. I actually have had this book. It was given to me by a very dear soul for maybe at least 8 years, and I haven't even gone through it all the way because I think it's just something where you read some of it and then you digest it and you figure out how you apply it. And part of it is called The Virtues of a Sustainable Life. The thing that caught me is the virtues of a sustainable life. And in order to create a sustainable energy and flow and connectedness in our life, that takes time. It takes, I think one of the greatest journeys of our lives is knowing ourselves and learning what we need and then honoring that. And this book really creates space to be able to do that. And so that's why I think it's a wonderful resource to be able to share with others. And then I will share the link to Vital Hearts because that will allow people to know they do online courses as well. And then, you can travel. There are continuing education credits there for that program. And then if someone's even interested in becoming a trainer at some point, they can. And then I had shared with you that I was able to record a podcast with my chiropractor. And part of my journey of self care is learning to honor rest for myself. And in some of the work that I've done with doing some education for healthcare providers, we've gone into different dimensions of rest. It's not just getting sleep. There are lots of ways that we can actually rejuvenate our energy. And so that's a wonderful resource that people can listen to. I feel so grateful when people share like a little nugget that spoke to them that I shared in that podcast. And then I have a lot of really amazing different types of body gratitude, loving kindness type meditations. So I'd love to pick just one or two to share. And then there's a meditation retreat center that's not too far from here called Spirit Rock, but they also offer online courses and they have sliding scales. So I think it's really important to remember that this work needs to be accessible to everyone. And that's what I love about the mindfulness community is that everyone is welcome and everyone's honored and the resources to be able to do that are figured out so that everyone can hold each other in that interconnectedness for healing that's necessary. So I really love that as well. I just chose those to highlight because I think you're connected to so many incredible resources. It could just feel almost overwhelming to a certain extent. So I just wanted to pick like a few key ones that I felt like will support patients going through treatment, their family members as well, and then along with the healthcare providers. I think with the aside of Vital Hearts being specific to healthcare providers, everyone else, every one of the other resources is truly just on a human level in figuring out how we can live the best expression of ourselves. And so that's what I wanted to show on those. And the last thing is like with the rest, I feel like it is really about figuring out the barriers of why we don't allow ourselves to have that. And I think I'd shared with you in one of our initial connected conversations was it can feel really difficult. And I've had this share with other patients too, when like in our culture specifically, productivity is really what you gain your worthiness on. I mean, I could speak for that for myself, and I see you nodding your head. And then when you don't have the physical abilities to be as productive as you typically are used to, how that can feel is it can be really intense. And to understand that that isn't true. And I always love that question. If I'm going down a rabbit hole in my brain, I'm like, is this
No,
true?
no,
And
this is
typically you're
great.
like, that's not true. So how can I go back to this space of taking good care of myself, honoring the rest that is needed for my mind and my body and my soul? Because then we can rise further.
Yeah. Eddie Edinburgh says so that we are in the business of busyness.
Mhm.
And when I spoke to him, I had already passed this time where last when I became cancer free, I've been in my first year of retirement. And so when I found out I had cancer, everything stopped. I was busier than busy before cancer. And I really truly believe that I was too overloaded with things going on and that was causing stress and all this stuff. But last February, I finally put my finger on it. I think it was February or March, why I was feeling so horrible and unworthy, unimportant, insignificant, all of that, because I didn't have anything I was doing anymore other than getting
Mhm.
rid of this cancer and dealing with this anemia thing. And so it was very difficult for me to get unstuck from there. And once we started going to therapy, and then we started to and talking about it, and then this podcast was born. And then I had a couple of other things happen. And so things are unfolding. Now I have to be careful about how much I put on my calendar so that I don't become stressed again. And so I'm very mindful about how many things I put on my calendar each day. And I make sure that I take part of my day for that mindfulness and exercise, and then maybe edit a podcast or something like that, maybe have an interview. So, yeah, I do think that we are a culture who that's how we feel like we have to be super, super productive all the time. And it isn't true.
Mhm.
So, um,
Yes. Yeah. Thank you for sharing. I feel like I will be able to learn nuggets from you around that because
yeah.
it's still a work in progress
Yes,
for me.
it is. It's hard for all of us because that is our culture. And
Mhm.
that's why I'm really very happy that you have not only provided resources for healthcare providers, but you've also provided resources for cancer patients and how they can move through their recovery and healing and everything. So thank you. I'm going to ask you to do something as we
Okay.
segue out of our interview. Can we take just that 30 seconds that we did before we got on and started recording and do a little mindfulness?
Mm. Yes.
So
Yes.
that
I
maybe the
would love that.
audience I would love my audience to be able to have a little snippet of what is possible.
Yes. Yeah. Thank you for inviting me to do that. I will do that. And then I will close that mindfulness with a little bit of loving kindness practice. I just like to share what it is that when I close so that people understand there's so many ways to meet meditation. Like you mentioned, moving meditation. It's not sit on a cushion and stop thinking. That's not the reality. It's like, oh, do whatever speaks to me. There's walking meditation, standing meditation, loving kindness. So just so many different possibilities. And really it's about finding out what serves you in that moment. And so loving kindness is always something that I love to end with as well. I would invite you, if you feel comfortable, to close your eyes and take a moment to just feel into your body. Be aware of the sensations that may be taking place. feeling the points of contact of your body being supported, whether that's standing or sitting, feeling your connectedness to the earth, bringing your attention to your breath. And then noticing if there's any space that's being called to in this moment. Maybe a space to nurture within yourself, to be kind to ourselves. And if your mind starts to wander, knowing that is completely fine because our minds wonder. That's what minds do. No reason to judge ourselves for our minds wandering. You can just notice that it's wandering. Maybe make a mental note of why it might be having that thought, and then coming back to our breath. And taking in this moment, being aware of where you are, feeling into our bodies as we breathe. May all of our bodies be filled with love and kindness. May all of our bodies feel wellness. May all of our bodies be peaceful and at ease. May all of our bodies be free from suffering and the causes of suffering. And may all of our bodies feel happiness. And then lastly, bringing our attention to the space that we've created together for all of the people that will be able to listen. Taking in the moment that we all are interconnected in some way, because it's led us to this moment to share. And holding all of those beings in our awareness. May you all be filled with love and kindness. May you all be well. May you all be peaceful and at ease. May you all be free from suffering, the causes of suffering, and may you all be happy. Thank you for giving me this moment to share with you.
Lovely. I feel
Thank
so
you. I
good
know it was
today.
longer than 30 seconds,
No,
but it was hard for me.
no, but
Oh, oh.
it has certainly made me feel ready to take on the day
Yeah, good.
in a peaceful way. So,
hmm
well, thank you very much, Amanda. It's been such a pleasure having you on my show, and I'm sure that we'll have other conversations that we can get back on here and possibly talk about other items. But this has been truly a treat, and I'm looking forward to you coming to yoga with me.
Yes. Oh, that's going to be amazing. I'm very
Yes, it
excited. And
will.
thank you
Yes, it
for
will.
that invitation. And thank you. This is a true honor, honestly. Thank you for seeing me and letting me be able to be there for you. And I feel so honored to know you and to be able to connect through this way. It's very special.
Yep. You've definitely changed my life for the better. And I just thank you. And to my audience, I appreciate your taking the time and listening to this episode of Test Those Breasts. And we will see you next time on the next episode. Bye for now.